Warm and pleasant good morning to one and all present here. It gives me great pleasure to extend to you all a very warm welcome on behalf of MLT Department of Royal School of Medical Allied Sciences. Today we are all assembled here for the talk on the topic Scope and Future of Medical Allied Science and for the inauguration of MLT Lab 2 Microbiology. I extend a hearty welcome to our respected Dr. Rupesh Kumar Sir, Coordinator of MLT Department, Dr. Siddharth Sir, Department of Biotechnology. I am profoundly delighted to take this opportunity to welcome our distinguished ma'am, distinguished guest speaker, Dr. Suranjana Chaliha Hazarika. Ma'am, we are very grateful to you for accepting our invitation. I would like to extend gracious and inclusive welcome to all our beloved teachers. And last but not the least, I would like to welcome all the students present here today. Moving on to the next agenda, I would like to request Dr. Rupesh Kumar Sir to kindly felicitate our distinguished speaker, Dr. Hazarika Ma'am. Ma'am, I request. Let's give a round of applause. Calling our guest speaker, I would like to give a brief introduction about her. Dr. Suranjana Chaliha Hazarika Ma'am, she is a highly accomplished medical professional with a world of experience and expertise. She earned her MBBS degree from Gauhati Medical College in the year 1999, followed by an MD in Microbiology from Assam Medical College in 2007. Currently, she is serving as an Associate Professor of Microbiology at Gauhati Medical College and Hospital. Dr. Hazarika Ma'am has dedicated 17 years to impactful research contribution including Assam Medical College and Hospital, Jorhat Medical College and Hospital, Tejpur Medical College and Hospital, and Gauhati Medical College and Hospital. Beyond her academic role, Dr. Hazarika takes on additional responsibilities with unwavering dedication. She served as a nodal officer from GMCH for the National Program of Surveillance of Viral Hepatitis. Furthermore, she is an integral member of the State Surveillance Team for HIV Sentinel Surveillance, demonstrating her commitment to public health initiatives. Incredibly fortunate to have her today. And ma'am, your presence enriches our event immeasurably, and we eagerly anticipate the knowledge and inspiration you'll impart on us. So without further ado, I invite you to kindly take over this stage, ma'am.
Distinguished faculty present here, faculty of Royal Global School of Allied Sciences, and my dear students, it gives me immense pleasure to be present before you today. I feel extremely privileged to come here and be a part of the inauguration of the medical laboratory, microbiology laboratory that has been inaugurated here today. And this is my first visit to the Royal Global University campus, and I have seen the infrastructure, the number of students. You have a huge number of students, the very experienced faculty, very dynamic, enthusiastic faculty, and I'm sure that you'll contribute immensely to the society as a whole when you pass out from this august institution. So, before because I think this should be an interactive session, so before we proceed further, I'd like to know the different branches that you belong to, like medical laboratory technology. Can you raise your hands? How many out of here in the audience belong to the medical laboratory technology group? So all of you. Okay, so basically this is a medical laboratory technology group audience, right? So we'll focus more on that. So the scope, because when we talk about allied sciences, it encompasses a very big group of skilled professionals who are serving in the healthcare delivery system. They are involved in the prevention, cure, and rehabilitation of patients who are suffering from both acute and chronic diseases, and they are contributing greatly for the well-being of the people of the society in general. So they are very integral part of the healthcare system, healthcare delivery system. So when we talk about the allied healthcare providers, they are a very big group. So we, the different branches that come under, you'll be knowing more about this, the different branches that come under this big group of healthcare professionals. First, we have the medical laboratory technology group. Then we have the people who are pursuing, courses in pharmacy, the B Pharm, the D Pharm. Then we have the courses in physiotherapy, which is also a very important part, because nowadays the people, in olden times, people like used to, they might be suffering from some diseases, they might be having some disabilities, some pain, but they used to, take that as part of their life and used to continue their life like that. But nowadays, because the wellness of the people has become so important now with the advancement of medical science, the professionals like physiotherapists, psychotherapists, these have gained a lot of importance. So that is one big group who look after the wellness of the people. Then we have the work in these different branches. They also form a very important part of the healthcare delivery system. Then we have the other groups like the forensic. We have the forensic medicine technology, then the ICU technologies, because nowadays there is a lot of advancement in critical care delivery to the people, to the patients. So we have the people who are highly skilled in dealing with ICU patients. Then nowadays we have modular operation theaters. So we have the operation theater technologists who look after the functioning of a very highly equipped operation theater. So all these are different people who are working. Then we have the people who are working in the, or who are serving the people through the imaging techniques, the radiographers, for example. So these are a large group of people who are the backbone of a healthcare delivery system. Now, what is the scope? Let's come to the scope. So, when we talk about the scope, the future is very bright, that much I can tell you. Especially for the medical laboratory technologists, after the COVID pandemic, you must have also realized that the government has realized, the public has realized that the laboratories need to be equipped with high-end equipment. They need to be prepared for any pandemic. They need to be prepared to face any any crisis, because after the COVID pandemic, we realized that the laboratories need to be highly equipped. So the medical laboratory technology has become a very important part of the healthcare delivery system, and the laboratories are now highly equipped. So we definitely need a lot of skilled professionals to run these laboratories. So when we talk about the scope, definitely there is a lot of scope of this healthcare, this group of healthcare professionals. Like when you pass out, you might think about joining the government service, because nowadays lots of medical colleges are opening. So in Assam itself, you'll be getting a lot of job opportunities. And then also we have, are you pursuing BSc in medical laboratory technology? So most of you are pursuing that. So you'll be, so many medical colleges are opening, so you'll be getting a lot of opportunities there. Then with the district hospitals, after the COVID pandemic, one thing was recognized by the government is that the peripheral healthcare system should be upgraded. So nowadays the district hospitals in Assam also, they're highly equipped. And the scale is also very good. And the future prospects are very bright in the district hospitals also. So if you get the chance, you can go there. Then you can go to, even the most peripheral healthcare centers are also highly equipped. Then we have the public hospitals. So you can go there. There's also public-private partnership hospitals where you can, join. Then we have the mobile units. We have the mobile vehicle, the laboratory units, where a lot of technicians, a lot of, skilled professionals are getting very good job opportunities. Then we also have the, apart from the, we have several NGOs who are working, I was working in the HIV sentinel surveillance. So there I discovered that a lot of people have been engaged by NACO to, work in this surveillance program. So lots of people have been very skilled people who are skilled in the medical laboratory technology. They have been skilled. They've been employed for the sentinel surveillance, and you can join some these programs by some of these programs, like the one run by NACO. Then NACO, that you must be knowing what is NACO. That is the National AIDS Control Organization, and we have branches everywhere in all the states. Then this sentinel surveillance is a big surveillance program that is going on. Then we have some other government programs. We have the hepatitis control program, we have the malaria control program, we have the tuberculosis control program. So many programs, government programs are going on. We have the National Vector-Borne Disease Control Program, where we have, within which we have the malaria control program, the chikungunya control program, the filariasis control program, the Japanese encephalitis control program, the dengue. So all these diseases are within this control program, and lots of people are even engaged in these programs. And these programs, they will go on for a long time, and the job opportunities are very good in these programs. The scope is very good. There is a great scope for learning further from these while being employed in these programs. Then we have the ICMR, the Indian Council of Medical Research, where you can, they're always recruiting dynamic professionals, skilled technicians. Then we have the NCDC, the National Center for Disease Control. So if you're ambitious, if you want to, go a bit further, you can join these centers. And we have a local one here, that is the RMRC, the regional center, which is a part of the ICMR, that is located in Lahual in Dibrugarh. So that is another center where you can seek, you can see your future there. So the basic thing is that you must be skilled. When you learn something, you learn it thoroughly. That is important. If you have the skill, you'll be finding a lot of opportunities, in different, in your field, in different institutions, whether it be a government institution, whether it is a private institution, or whether it is a public-private setup. And of course, nowadays the salary is also quite high. The opportunities are much more than before. The laboratories also have been highly upgraded. So the satisfaction that you'll get from working in these different setups is also quite high. But we also have responsibilities. When we have these dreams of working in big setups, big institutions, we also have some responsibilities. The first is that we have to gather the knowledge. We have to, when you're pursuing your studies now, you have to have the vision that I'll be, it's not that you have to work in only one, you have joined one institution and you'll always remain in that institution. It's not like that. You can always improve yourself, and you can always upgrade to a better, higher institute. And if you are, if you work hard, if you do well, maybe some of you might join as faculty in some of the educational institutions also. And lots of educational institutions have come out, which are where allied and medical and allied sciences is a part of the curriculum. So you can join these institutes also if you want to. And MSc, I think, is also going to be open. So it's not that you have done your BSc in medical laboratory technology and that is the end. You can pursue your MSc, you can go for PhD. So your ambition, your dream should always be very high. Okay? It's not that you'll only, just find a job somewhere and that will be the end of the road for you. That should not be your aim. So you should always strive for better, for higher, more higher learning to better yourself, so that ultimately your dreams are achieved and you get satisfaction from what you have. You should have that thing that I have joined a very good stream and I'm satisfied with this stream. I'm doing well. I'm giving back to the public, to myself, to my family, to the public, to my institution, because I've joined this stream, this branch of medical science, and you should also get something in return. You should get recognition, you should get, a good job, and you should get job satisfaction because of joining this stream. And of course, the future of medical laboratory technology is very bright. Bright in the sense that people are realizing, these medical laboratories are not only now present in the urban areas. The rural areas are also now coming up. These laboratories are being set up in the rural areas also, in the remote areas also. So it's not that, people say that, these laboratories are all concentrated in the cities. Nobody is going to the rural areas. So those days are now over. Even the government and the public, lots of organizations are taking steps to see that the remote areas, the rural areas are also being developed. So if some of you are from rural areas, you should, go back to those places. I don't know, some of you might be from urban areas, but some of you might have come from rural areas. So, or some, areas which are, from some very remote places. So your aim should be that I'll go back to my place, to my native place, set up a laboratory there, set up a good laboratory there, use my skill, use my knowledge, and then serve the public. So that should be your aim. The government, lots of NGOs, lots of organizations will support your venture if you try to go to the remote areas. Then what should be our duties, our responsibilities? So as a medical laboratory technologist, so you are pursuing pathology, microbiology, and biochemistry, right? These are the branches. Is that okay, right? Or yes, and what else? Anything else that comes under the laboratory under your curriculum? Hematology. Okay, and then anything else? So these are the branches. Okay, so out of that, how many of you are interested? Because today was the inauguration of a microbiology lab. So how many of you are interested in the microbiology stream? Because ultimately, when you pass out, ultimately when you work in a laboratory, you'll be, some of you will be working in a pathology laboratory. You'll be totally dedicated to the pathology laboratory. Some of you will be in a biochemistry laboratory. So you'll be dedicated to that. Some of you will be coming to microbiology. So how many of you are can you say how many of you are interested in the microbiology laboratory? Because today was inauguration of a microbiology laboratory. Nobody's interested? You're interested? Okay, and who else? Okay, that's very good. Others are not interested in the microbiology laboratory? Because I'm myself from microbiology, but I can tell you one thing. It's very good that you're interested in pathology or biochemistry, because most of the laboratories have those centers, but microbiology is also coming up. Right? Microbiology is also coming up. So lots of jobs will be created in microbiology. Already it has been created. Under NHM, lots of microbiologists are getting jobs nowadays. Do you know the NHM, the National Health Mission? So lots of jobs are coming out in microbiology also. And those who are not belonging to Assam, from some other states, in those also, I can tell you that microbiology is coming up in a big way, and you'll be getting a lot of jobs there. And after the COVID pandemic, one thing I can say that microbiology has been recognized as a very important subject, not just pathology. Previously, it was thought to be a part of pathology, but now microbiology has come up. And you can take, I myself recommend that microbiology will be a very good, satisfying, course for you if you want to pursue that further in your MSc. Maybe in your MSc, you'll be specializing in something. Or maybe when you do your PhD, you can take up microbiology. And the future of healthcare, allied healthcare services as a whole is very bright, because people are now have realized the importance of health. People go to different, people are willing to pay to get the services. So the laboratories have to be very highly equipped with all the machines, all the expertise to deliver those services to the people. People both in rural areas, mainly in urban areas as well as in rural areas, they have become very conscious about their health. So the laboratories need to be equipped very well to deliver those services. The people, the healthcare providers will be working in those laboratories have to be very skilled. So yours is a totally skilled job. In healthcare services itself, we have the physicians, we have the nurses, and then we have two sections. One is the skilled professionals and one is the unskilled professionals. So we'll not consider the unskilled professionals. We are considering the skilled professionals here, that is you. So you have to have the skill. Your recognition will be through your skill, how much you can deliver to the laboratory. So there, your sincerity, your dedication towards your profession will be very, very important. So definitely the future is very bright, because people have recognized the importance of health. They'll be demanding a lot of services from the healthcare delivery systems, and they'll be demanding a lot of services, a lot of input, of services from you. And so your duty will now be to deliver the services to the people, and in return, you'll be benefited. Your skill will be recognized by society, and you'll be benefited. And when we talk about healthcare delivery systems, there are different aspects. One is the medical system, where people with chronic or acute diseases come to the hospitals or the doctor's chambers or to the laboratory to seek services. So that is the medical delivery, healthcare delivery system. And then we have the wellness system. Within the wellness system, we have other sections, like where the people are not exactly sick, but they want to better their life, the quality of their life. So there we have the physiotherapist, the dietitians. So if you go, it's not just the hospitals which will be employing these people. We have the dietitians and all that. They'll be employed in the gym, the wellness centers, in the entertainment industry. So there they'll be getting a lot of employment. And then we have the psychotherapists, the psychologists, because behavioral problems are very common in society nowadays. So there also they'll be getting a lot of opportunities. And the corporate sector also nowadays, they all like here in Royal Global University, it doesn't have a medical college or a hospital, but we have a laboratory here. Why? Because it wants to give service to the in-house. That means the people, the faculty, the students who are studying here, the staff who are employed here, they want, the university wants to provide services to those people who are employed here, who are studying here. So that is why we are having a laboratory here. And when we have a laboratory here, we have to have the people to run that laboratory, skilled people to run that laboratory. So we have that here. So definitely, it's not just a Royal Global University. Any corporate sector, any corporate institution, office, big corporate office, they have their laboratories. Why? Because they want to look after the people employed there. Schools, nowadays even schools, the big schools, they have their medical laboratory. So any kind of initial diagnosis that is required can be provided in those laboratories. Of course, if it is something, it requires some more advanced testing and all that, that can be sent to some referral centers. That is different, of course. That can be sent to some, nearby hospital, big hospitals or medical colleges. But otherwise, all these, the corporate sector has also realized the importance of the wellness of their faculty and staff, or the people working in those offices. And, if it's an educational institution, the students. So all these are very important. Their well-being, their health is important. So any kind of any kind of small test or initial tests that are required should be done in house. That thinking has come now, especially in the urban areas. So that is another avenue where you can find a lot of job opportunities. So if you want to work in the private sector, corporate sector, it's all up to you. The only thing that is required is that you gather the skill. The skill, that is the most important thing. That skill that you'll gather here. Now you're pursuing a course here. That is a 3-year course, right? That you're pursuing here. How long is the duration of this course? 3 years? So 3? Okay, so 4 years. So 4 years is like even MBBS students also go for a 4 years course. So you're also going for a 4 years course. So in 4 years, you can learn a tremendous amount. You can learn all. You can never say, give that excuse that the course was very short. I did not have time to learn everything. So you can learn all the different aspects of your profession within these 4 years. So when you pass out, you should be totally skilled. This skill no one can take from you. I know this is a filmy dialogue that I'm telling you now, but it is true actually. The skill that you have, no one can take from you. Whether you stay in Gauhati, you stay in your own state, because people from the different northeast states are also here, I know that. So you can go to your own states also, or you can go outside. It's not necessary that you have to stay here only. SMEs people, I know, I'm not talking about the other states. SMEs people have the tendency, I want to stay in my hometown or nearby my home, or maybe in Gauhati itself. But you, as young people, you should venture out. Lots of opportunities are waiting for you out there, and you should have that ambition. Make your life better. Go out, make your life better, learn more things there, and maybe come back one day and teach others here. That should be your aim. It's not that I'll just take the degree, go to my hometown, set up a small lab. That should not be your aim. Maybe many of you will do that. That is also good, because you want to serve the people in your locality, but that should not be the aim of everyone. Some of you should go out. Those who do not have any constraints in your home, problems in your home, who can go out, should go out and give to the people outside, learn more and more from them, and also give back to your native place in return. That should be your attitude. So all these, with this thinking, if you continue with your course, if you, in the next 4 years, if you continue, definitely learn a lot. And when you pass out, after that, some of you will be joining, some institutions, some laboratories, but others should also go for higher studies. You should go for, because their MSc degree, in MLT is in the pipeline, so you should go for that, and then you can also go for your PhD. You'll be a totally highly qualified, skilled professional, and you should be very proud of that. You should be very proud of what you have achieved and become. And the scope, I have told you, again and again I'm telling you that the scope is very bright. We have now, medical laboratory. During the COVID times itself, the laboratory, we have a lot of laboratory technicians in GMCH. During the COVID times, what happened? Because I'm telling, again and again I'm quoting the COVID times, because we as healthcare professionals learned so much during this pandemic. What we did not learn, maybe in when I joined MBBS, it was in 1994. So almost how many years? 30 years. So 30 years of my medical life, what I did not learn, I learned in those 2 years of COVID. What is a pandemic? That we learned. How to deal with a crisis, we learned. So how to mobilize our resources, because resources will always be less. When you join a lab, your resources, it's not that you'll have everything at the same time. To how to work with the minimal resources and bring out the maximum output. That should also be your aim. In GMCH, for example, we have a lot of patient samples, but we don't have so much of resources. It's not that we have lots of, if you have seen the, the microbiology laboratory, we have those agar plates. Have you seen the agar plates? Blood agar, nutrient agar and all that. So, especially for making the blood agar, we need sheep blood. And this sheep blood is, we have only a few sheep. Yeah, they keep dying and all that. We have a person who looks after that shape. He also doesn't do his work properly. So it's very difficult to make those blood agar. So what happens in one agar plate? Ideally, we should be culturing one sample, inoculating one sample or maybe 2 samples at the most. We are inoculating 10 samples. We are, making sections in the same agar plate, making 10 samples, and we are making it work. That means we are using very limited resources but still we are delivering services to the people. So even your outlook should be that with limited resources, I should be able to, if you're skilled, you should be able to do that. If you know your job, you'll be able to deliver the services. So when you join a lab, maybe you'll be seeing that this machine is not there, that is not there. So your thought should not be that, how will I work? So somehow you have to manage. So during the COVID times, that's what happened. We did not have those PCR machines and all that, those came later. Initially, we had only one PCR machine, maybe. With that machine, the whole machine was running 24 hours. The laboratory technicians who had never entered a molecular lab, we trained them. Within 1 week or 2 weeks, they learned how to do DNA extraction. So that means what? That you should be a learner all the time. Okay, that learning process, you have passed out BSc in medical laboratory technology, you have gained some knowledge, that should not be your end point. You should be always ready to learn new things, right? That thing should be always there. I'm ever ready, because during the COVID times, we have seen some technicians, they backed out. They said that, no, I'm not, molecular part I cannot do. Okay, some they just backed out. They were not ready to learn new things. But there were others who came forward, they learned DNA extraction, they even learned to do PCR. The end result is that the COVID pandemic is over now, it's no longer there, but those persons who have learned that skill now, definitely their demand will be more. So it's a competitive world. So many of you will be passing out. So you look at each other, so many of you will be passing out. So you are all competitors of each other actually. You'll be entering the job market at the same time. So the more skill you learn, the more will be your demand. Nobody will employ you. Your employer will not be someone who is interested in, what you have to say, what is your degree, ultimately how much you know. They'll see you, they'll employ you maybe. If they're not satisfied, they'll employ someone else. So yours should be always an ever learning. It's a never-ending learning process, and you should always be very enthusiastic and dynamic. So you're all very young people now. You'll be going out into the world. You'll be entering a very competitive world. So you should be totally, focused, and you should, you should always, think that I'll be learning more and more. I'll increase my skill, and in this way, I'll be serving the society. Do you have any queries that you might like to ask me? Because these are things, what I'm saying is already medical laboratory, like the technical part you're learning in your, you can ask me anything. That will be better, because this is supposed to be an interactive session. These were the things that I wanted to say. It's just a pep talk kind of thing, that you have entered a very good profession. There is a great scope of learning. You should always be a learner all your life, because I'm a learner. I'm still learning. So that should be your aim also, and you should shine bright in life. That's what I have to say actually. Yeah?
Informative talk. Ma'am, I have a small question, ma'am.
Yeah.
Ma'am, can you please tell me about the upcoming career opportunities in allied healthcare professional like medical laboratory technology?
Yeah, about career opportunities, definitely one thing I can say is that nowadays there is automation in laboratory. Do you know what is automation? Everything is going on automatically. Now in GMCH, it's one of the very well-equipped laboratories. I work in a microbiology laboratory, so I'll give you the example of a microbiology laboratory. So in GMCH, for example, every part of the, we have got some very high-end equipments, okay? Every part of the processing, the culture, what we do, everything is automated. We have the Vitex system for the blood culture, we have the bacteria alert, we have the MultiToF here. It is one of the very high-end equipment. Within half an hour, you can get the identification. Suppose you have put in a urine sample. When we do the conventional culture, it takes about 24 hours to know the identification of the organism, and another 24 hours to know the antibiotic sensitivity pattern. But in MALDI-TOF, within half an hour, you can know the identification of the organism. It is that fast. That means what? We are delivering services to the people so fast, right? So these automations have become a very important part of a laboratory now. It's not just in microbiology, it's everywhere. So that is one opportunity, like you can, there are courses where you can learn about these automation processes, and there are, the research, there are lots of research going on to develop. In IIT Gauhati, we have a tie-up in IIT Gauhati, with IIT Gauhati, where they are trying to discover more and more, machines or instruments which can, it's not just in microbiology, which can benefit our patients. So they're recruiting a lot of young talent, which includes medical laboratory technologists, because when someone is having that concept of building a machine, there'll be the engineers, the thinkers, and someone has to do the groundwork, to testing part. They are sending us samples, we are testing here. So those programs are also going on, and the research is going on there all the time. So research is one area where there is a lot of opportunity. You can go to those research facilities if you want to, go for some higher, further, enhancement of your knowledge. And of course, automation is one field where you can learn a lot of things. We have, when you go into, with these machines will, provide a lot of service to the people in general, and you'll also learn a lot of things. And this is one good area, automation in laboratory. That is one area where you can, if you want to go for a more scientific, more, because otherwise it's a routine kind of, you're coming, doing laboratory work. Of course, it becomes a bit of routine. It will be like you'll be doing processing samples daily, giving out reports. So that is one part. But if you want to go into research, it is a good career opportunity, because lot of new things are coming up. AI is being employed now. Lots of software are coming up, which are these machines are using this AI. Of course, people are saying that the AI will replace the skilled manpower, but that is not so. AI will never replace us or you. AI can never replace skill. So you can, so never have that thought in your mind. So you can, go for those career opportunities where there is a lot of research going on. Okay, apart from entering some healthcare delivery system where you're giving, going for processing of samples, giving results. So that is one part. And that the research, joining research is another part. You can do that. And sports medicine, that is another aspect. In sports medicine also, like, sports medicine, the entertainment industry, even there also, of course, the dietitians, the physiotherapists, they have a lot of role. Even as I said, the corporate sector, the entertainment industry, all are having their, that wellness industry is very important now. So you can go to those avenues also if you want a more, uncommon or different kind of career. There also the importance of our medical laboratory technologies is there, because that wellness industry, I'm not talking about the medical, the person who is having disease, that is one sector. Another sector is the wellness industry, where people, they're not having disease, the prevention of diseases, or wanting to have a better quality of life, that is also another part. Even the laboratory people have some role in that. So you can look for that. I hope I have answered your query.
Respected ma'am.
Yeah.
I have a small question. Ma'am, you told about the AI. How does the integration of AI and learning machines affect the scope of healthcare, medical healthcare sciences?
Pursuing his engineering in computer science, and he has specialized in AI. So whatever AI I have come to know, I've come to know from him. So basically, when we talk about AI in general, we are using AI means lots of this automation that is going on. Like you put a sample in a machine, you get the report. That is AI actually, right? So we have these closed systems nowadays. The PCR closed system, lots of closed systems are there where everything has been automated, fit in the computer. Okay? Lots of high-end machines. We are using them. Okay? Especially during the COVID, lots of machines came. We are doing lots of using lots of machines where we put the sample. Everything is fixed there. How many cycles will be used? What will be the time? What will be the temperature? Everything is fitted in the machine, and after that particular time, we get the report. People do not have to do anything. Okay, those are there. But so this is part of AI actually. But what I want to tell you is that I was asking my son, he is back from his hostel for his vacation, and I asked him, will AI replace us? Because everyone is having that fear that AI will replace us. But he told that AI can never replace human beings. Because the person will be putting that sample, using those, giving those conditions in which the machine will run, that will be a human being. Ultimately, to run those machines also, AI means actually machines. Machines will be doing our work, okay? But to run those machines, we need human beings, skilled human beings. So ultimately, never have that fear that AI will replace us. AI will never replace us. AI is basically means the machines, the high-end machines that where everything is going on automatically. That was what I was telling him about. But to run those machines, we are required. So we'll never be replaced. That is the thing that my son told me, and I was reassured. Okay, he said, AI will never replace us. Okay. Anything else that you'd like to ask?
So, ma'am, I want to know that what are the challenges and opportunities of for global health initiative as a medical professional?
System. We are part of this big. I as a whole feel very privileged that I belong to this system, and you should feel that pride also because we are serving the people, right? So the challenges will be that medical science is an ever-changing process. It's an ever-changing process. Things that you've learned today, newer and newer things are coming up all the time. So you'll have to keep yourself updated all the time. So that is one challenge. You cannot sit back. I've told you before already that you have taken your degree, you have learned things while pursuing your course. After that, you cannot sit idle. Right now, I'm quite old, nearing my 50s, in my late 40s, that much I can tell you. Still, every morning I wake up, I devote some time to learning the new things that are happening in microbiology because it is always evolving. So you have to, have that mentality. If you want to rise in my profession, that thing, you have to evolve yourself all the time, learn new things. That is one challenge. Second is that I've already told you, another challenge is that resources will be less. You have to learn to work with less resources. Okay? You cannot complain. Suppose you have joined an institute. They do not have a particular. You're used to using a particular machine. Like I was working in Gauhati Medical College. Then here we are having all the machines. Then I was transferred to Tezpur Medical College when it was newly established. Because ours is a transferable job, I was transferred there. I worked there for some years. They did not, it was just a new medical college. The equipment which we were used to were not there. But still, it's not that I'll complain there, that I'm used to these machines, I'm used to this hi-fi setup, so I cannot go and work there. I cannot say that. So I'll have to learn to work there in that setting. So you have to be adaptive, you have to be flexible. You should be able to work in a very high-end laboratory also, and you might, your situation might force you to one day go to a very remote laboratory and work there. Laboratory in a very remote area. There also, you should be able to adjust and provide your services. Okay, you cannot crib that I don't have this, I don't have that, so that should not be there. And thirdly, the third challenge is that what we faced in the COVID pandemic. It was something that we never expected. So in future also, lots of diseases will be, some, especially the infectious diseases, many will be coming our way. Now we are prepared, you should also be prepared. Okay? When the COVID pandemic happened, we were not prepared. Like during the first wave, we were so panicky. So many people died because of the panic status that was created. People used to fear going to near those COVID patients, though they suffered from lack of care and all that. So that is just an example. So we should be, because healthcare system after the COVID pandemic, we have learned that we should be always prepared. Newer and newer diseases are emerging and re-emerging. So these newly emerging and newly re-emerging diseases, re-emerging because some diseases are there which were present long time back, again they're happening now. These are the re-emerging diseases. And then we have the emerging diseases. So those are the infectious diseases. Then we have the lifestyle diseases. They are also on the rise. So the burden of disease people will be more and more. Population is also rising. You have to learn to work in such an environment. So that is another challenge that you might have to face. So the thing is that you should have an optimistic outlook, dynamic, always a spring in your step. Daily when you go out for your studies now, or in your future life when you go out to work, you should always have that positive attitude that today also I'll do something. That if you have that attitude, of course, you'll be able to face all those challenges. Thank you so much.
So as you said, you are from microbiology department. So in microbiology department, we hear a lot about antibiotic resistance.
Yeah.
So how can the field of MLT adapt to address such global hazards? As we know that we had pandemic and we have addressed so nicely about the pandemic. So how can we address to such such health hazards like antibiotic resistance?
Is by her. Thank you so much. Please sit down. So antimicrobial resistance, or what we call in short AMR, that is that is a silent pandemic. That's what we say. It is a silent pandemic. Most of the antibiotics are now, most of the bacteria are now resistant to most of the antibiotics. So how we have a program called antibiotic stewardship. That means in every hospital we have an antibiotic policy. Okay, we should have actually. Some hospitals may not have, but they should be having an antibiotic policy. Antibiotics should not be used unjudiciously. That is the duty of all the healthcare professionals, starting from the physicians, the postgraduate trainees, the MBBS students, the laboratory technicians, everyone. Even you'll be, because you're doing putting the antibiotic sensitivity and all that will be your job. Okay, the antibiotic sensitivity test. So you should be very sincere when you do this. You go, okay, if you want to, what we call it palmaru, that means, I am not doing it according to the proper protocol. If you do like that, then you'll be reporting it all wrongly. Then the patient should be getting some other antibiotic, but he'll be getting some other antibiotic, and resistance will be more and more. So when we prescribe drugs to patients, it should only be when they actually require it. What happens? And since you belong to the healthcare sector, people will be asking you, okay, common man, the layman, or your relatives, your family, friends will be asking you, tell me, I'm suffering from this cold or maybe this fever, tell me what antibiotic I should take. So always remember, antibiotics do not act against viral diseases. So most of these people suffer from viral fever, suffering from common cold. That is actually because of some viruses, not because of some bacterial disease. And when we give these antibiotics to these people, that means what happens? Resistance, because bacteria is always there in our system. These are the commensal bacteria. That means the bacteria which are the normal flora of a person. They develop resistance. And these resistant strains will now spread in the community, in the hospital environment, and lead to more and more drug resistance. So it is very important that you should always be alert. You are part of the healthcare system now. You should always be very alert that antibiotics are used judiciously. That is the only way how we can tackle this problem of antimicrobial resistance, because that is a very, very big problem now. We have Klebsiella. Have you heard of Klebsiella? Pseudomonas. So these are some of the gram-negative bacteria that have become multi-drug resistant. That means no drugs are working against them. And the important thing is that they are usually found in the hospital environment. they usually infect the people in the ICU, the people who are suffering from some other diseases. They are present in the ICU, they are fighting for their life. They infect those people, and the people ultimately die because of septicemia caused by these multi-drug resistant organisms. So it is very important, very, very important that antibiotics should be used judiciously, and this comes under the antibiotic stewardship program that is present in hospitals. So that we have a very big responsibility, and you also have a very big responsibility. So if you start working in a microbiology sectional laboratory, you have to know which antibiotics should be given for which organism. Like we have the gram-positive and the gram-negative organisms, right? Do you know that? We have the gram-positive cocci and the gram-negative bacilli. So the antibiotics which are reserved for the gram-positive organisms should not be given to the gram-negative organisms, and vice versa. So all these things, ultimately the bottom line is that you should have the proper knowledge and the skill. If you know that, then you'll be able to stop all these things. If you don't do your studies properly, somehow pass out from your university, somehow get your degree, and without knowing fully about all these things, if you join a lab, then definitely you will not be able to do all this, take all these steps. And you'll be doing a disservice to the society. That is why it is very important right now that you know your skill. Thank you so much.